Welcome back to the last segment of a Wednesday, middle of the week. We catch up with our resident eye specialist from Visique, Tony Bland. Welcome.
How are you doing there? Good to see you again.
Good Easter?
Yes, very nice.
A wee while ago now, but you're not nice and relaxed after it?
Yeah, it's always nice to have an extended break.
Good stuff. Talking laser surgery.
Yes.
Frightens the dickens out of me.
Right.
Someone sticking a laser near my eyeball.
Yep.
What's the story?
Well, often people come and talk to us, who want an alternative to spectacles. Often there's people who are wearing them full time, and we'll look at other things like contact lenses, but sometimes people want a more permanent option. So often they come in and talk to us about laser surgery because they've either seen it on television or have had friends who have it. But that's actually only one of the options available to people nowadays. So we'll often, a way we talk about people is sort of surgical correction of your vision, because there's a couple of alternative ways of doing it. Okay,
so I guess we're talking a choice thing, so you give people the choice of you can have glasses, you can have contacts, or you might like to look at one of the three options if it's of interest to you. So it's not a thing you would prescribe to someone.
No, not necessarily, exactly, you're right. Usually people, most commonly people typically have worn glasses or contact lenses for a while and want a more permanent alternative. Mainly because we want to ensure that the prescription that they wear is relatively stable. There's little point in having some kind of surgical correction if your vision's still changing, because that would imply maybe you still need glasses again afterwards, which would defeat the purpose.
For sure. So let's go through them. Laser surgery.
So the laser, basically what happens is over your iris you've got a clear layer called the cornea, and that's like the windscreen of your eye. And what the surgeons do then is basically take a laser which is controlled by a computer, and they guide it as well, and that basically is used to reshape the corneal surface. And the idea is that brings the eye back into focus. Because typically if someone is long-sighted or short-sighted, the image is in focus at the retina at the back of the eye. So the idea is to adjust the focusing by reshaping the cornea with the laser, if you like.
Sounds terribly painful.
No, there's no discomfort involved, and that's again part of the process that we talk to people about, and same with the surgeons. It's to reassure people that it's comfortable and easy to do, and the results are instant. Literally people can see nice and clearly pretty much straight away.
This is, I mean, laser-wise, is this a fairly new technique, or has it actually been around for a while?
It's been around probably for around about 20 years now,
okay.
But the technology has improved dramatically. So whereas they first started lasering the surface of the cornea, nowadays what they actually do is actually laser the inner layers of the cornea, and so they get a more stable and reproducible result. And the laser technology and computer technology has naturally improved dramatically. So the surgeons are always keeping themselves up to date to give you the best result ultimately. And they're always fine-tuning and improving their calculations and their approach to it. It's really interesting to work.
Clever, eh?
Yeah, really amazing.
Clever. Implantable lens.
Yeah, so the two alternatives to laser surgery, there are some people who aren't suitable for laser surgery for different reasons. And so the alternatives, we have an implantable contact lens. Now nowadays, if there's enough space, you have a natural lens in your eye behind your iris, and the surgeons actually carefully insert a lens in between the iris and this natural lens, and that can focus the eye at the same time. And that's proven to be really, and that's again been around for a little while, but it's proven to be a really excellent option for people who can't have laser surgery, maybe with very high prescriptions or unusual prescriptions. And again, they just carefully measure the dimensions of the eye and choose the power of the lens that they put inside and come up with nice and clear vision as well. It's just quite incredible.
That's amazing. And intraocular lens, this is sounds a bit
And the third one, again, is a similar idea. When you have a cataract in your eye, the natural lens in your eye goes hazy and cloudy, and you can't see through it as well. And when the surgeons remove that, they put a new plastic lens inside, so that lens is actually replaced altogether. And same thing, now what they do nowadays when you have cataract surgery is they actually, again, take careful measurements of the eye and correct the vision while they're at it. So people often needed glasses before cataracts, don't afterwards. Now nowadays what they're doing to, a number of people too are having what's called a clear lens extraction. So they're having that lens removed before they even get a cataract to correct the vision at the same time. And so, typically people who, again, may not be suitable for one of the other techniques have that as a third option as well. And so, the main thing about it is the surgeons can offer more alternatives too.
Does that make your job easier or harder?
Oh, I think it makes it more interesting. It's not necessarily, I wouldn't say it's harder. I think the good thing is we can, a lot of the process from our end is really just helping people to understand the implications of the changes in the vision. So typically, for example, people may choose to have their distance vision corrected, and they may still need glasses perhaps for reading afterwards. But, if they have quite a significant prescription, maybe relatively thick lenses, they're quite happy with that. So we do a lot of discussion with the patients on, the implications so they can really get a full understanding. And again, that's all reinforced by the specialists as well. So we're often quite involved, beforehand, and then we'll also spend quite a bit of time catching up with the patients afterwards too. So, some of the surgery is done right here in town, but people also go to surgeons out of town in Hamilton and Auckland. And to save them going backwards and forwards across the countryside, we'll do all of the follow-up visits here in Rotorua, and we'll look out for the issues that need to be dealt with, and again explain to people what the normal changes that occur as their eyes are healing and coming right as well.
And the thing I am staggered about every time I talk to you about the eye, and certainly procedures like this, is how instantaneous it can be for people.
Yes, well, it's typically, it's exactly the same as putting on a pair of glasses. So typically, once the lens is put in their eye or their eye is lasered, the vision is clear straight away. Sometimes there's maybe a patch or a bandage for a few hours afterwards, but the vision is corrected instantly, and people are often astounded with how it is. It's just amazing.
So if people want to find out more, they can come and see you at Visique.
Absolutely.
Absolutely.
Yep.
Tony, thanks for your time.
You're welcome.
Awesome stuff. That is it for the middle of the week for a Wednesday. Anything at all you would like on the program, you can phone us during business hours on 0734 88984 or email us news@tvrotorua.co.nz. Enjoy a nice relaxing night at home, and we will see you back tomorrow, Thursday.
Supporting local content so you can see more of New Zealand on air.